So my name is Dr. Mackenzie Cervenka. I am the director of the Johns Hopkins Adult Epilepsy Diet Center, and I'm happy to be here to talk a little bit about the ketogenic diet and my work with the ketogenic diet and the modified Atkins diet in adults with epilepsy. So first I was going to talk a little bit about the differences between the ketogenic diet in children and the ketogenic diet in adults. And I think the big picture is that there is not very much difference, and that's been sort of my motivation for the work that I'm doing, because when I began this, I thought to myself, what is the difference between a 17-year-old with Rett syndrome, for instance, and an 18-year-old with Rett syndrome? The 17-year-old was offered the ketogenic diet as a child because the physician knew that that might be beneficial for the treatment of seizures in a patient with Rett syndrome, but an 18-year-old coming to my clinic just wasn't offered that as a child. Why would I think that that patient would respond any differently to the ketogenic diet or would have less benefit? That has been the motivation for my work, because I really do believe that those patients can respond as well to ketogenic diet therapies. I think an added challenge that I have in my field is that by the time patients come to my clinic and have never been on a diet, they've had an entire childhood experience of a certain diet by that time. It wasn't introduced when they were young, and so it is a big shift in their lifestyle. And that's also true for older adults who have really become kind of set in their ways, so to speak. And so I think there's that added challenge of compliance with adults, because they have really already defined what their food preferences are and things of that nature. But other than that, I do not think that it is something that shouldn't be tried in adults. I think they should have all of the opportunities to be treated with ketogenic diets just like children.